going to talk to Fraser and his mum Annie to teach them how to use Fraser's new puffer, his MDI, with his important asthma medicine in, and his spacer. So welcome Fraser, welcome Annie.
Thank you.
Have a seat. Okay, it's really important that you get the child involved as much as you can when you're teaching inhaler technique, because after all it is their spacer, and the more familiar they become with their condition, the better able they'll be to manage it in the future. So I'll involve Mum in for the first part, and then we'll see what Fraser can do. So welcome Annie. So Fraser, this is your new puffer with your medicine inside, and you can see I like to call it Percy the puffer. Okay, and Percy the puffer has a little hat on the end there. So before we get this to work, we need to take Percy's hat off. Can you do that for me? Brilliant. There you go. Okay. Now we need to wake him up, because Percy's a very sleepy little puffer. So we need to give him a good shake. Okay, brilliant. And then we need to pop him in the end of the spacer, because this is your special new spacer device, and this helps get your medicine all the way down into your lungs here, where it's going to work and help you stay well. Alright? So I'm going to pop the face mask over Fraser's nose and mouth. Annie, can I get you to hold Fraser's spacer? I don't want you to worry about that, Fraser, at all. It's just going to be very gentle. But Annie, I need to make sure that I've got a good seal, so none of the medicine escapes. All right? Now, Fraser, what I'm going to do is I'm going to press Percy's little top, and you'll hear a shushy noise. Okay? I want you to breathe in just normally and gently to the count of 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. Well done, brilliant. Now we can take that away. How was that? Was that okay?
Yeah.
So sometimes what we may need to do is repeat the dose. So the next time I'm just going to get Fraser to hold the spacer. Now he's a bit more familiar with it. Can I get you to hold that there for me, Fraser? Fantastic. Now Percy's gone to sleep, so I need to wake him back up again. So I take him out and I hold him. I say, wake up Percy, can you do that for me? Wake up Percy. Fantastic. Brilliant. Now he's nice and ready to go. Okay, so can you hold that for me, Fraser? And this is where he might need a little bit of help from you, Annie, but let's just see how things go. Can you try and press that for me, Fraser, with that? Is it quite tough? And this is where sometimes Mum does need to help for a little while. Fantastic. And we repeat 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. Brilliant. Well done. Fraser made a beautiful seal, so none of the medicine escaped. Thank you. And all we do now is make sure that we take that off, put his little hat back on, put him in his box, and he's ready to go. Spacers with a face mask are really effective for young children, and normally what we'd encourage is that children under 5 use a spacer with a face mask. This will make sure that the medicine goes right down into their lungs. However, if they're ready a little bit sooner than that to go over to use a spacer with a mouthpiece, then we would practice that and teach them that technique. When they get it right, then we'll move over to a spacer with a mouthpiece. Thank you.
For more information, please go to our website at www.anniebarr.com or call us on 01 661 844 327. You can also keep up to date with all things Annie Barr on LinkedIn, Twitter and Facebook.